Welcome to another episode of Cutting Edge Health. Today, we're talking about TDCS, a modern therapy for improving memory and stopping decline as you age. If we haven't met, I'm Dr. Orlando Landrum, a physician that helps patients understand their options, not just traditional ones, but ones that help you be able to do the things that you want to be able to do, live a long life, and be able to enjoy that length of time. Today, we're talking about TDCS, which stands for transcranial direct current stem, but we need to set the stage a little bit. One of the things that we see is that as we mature, that we start getting less sharp. And so we can see that cognitive decline becomes impactful to us being able to be autonomous and be able to do the things that we want to be able to do. And so as we start looking at those age groups and who's in place, we can be able to see that there's a distinguishment between differing ages and groups. So we have the silent generation, we have the greatest generation, which is still around, the baby boomers, which comprise about 1/5, as we're going to talk about in the near future, of the entire population here in the States, Generation X, millennials, Zoomers, and then Generation Alpha. So how does this affect individuals? We're going to talk about that and why that's the case. As we look at the numbers of people right now, we can see that the silent generation is having a shortage of persons as they start passing away. And we can see that of the subsequent groups, baby boomers are actually about 1/5 of the remaining groups. So when we think about how does cognitive decline impacts those individuals, not just baby boomers, but even those who are in part of the aspect of Generation X, one of the things that we can see is that when we start going up in age, we have a marked exponential increase in terms of cognitive decline, sometimes from about 1 out of 10 individuals to as much as 1 out of 2. And one of the reasons that we can be able to kind of deduce that is we can see the following. We can see that this cognitive decline traditionally progresses when we take a look at this type of graph. And this graph shows us cognitive performance, which is present in blue. So just overall, we can see this decrease that occurs where we can be able to kind of say, oh, well, this is something that someone can be able to maybe be able to interpret versus knowing definitively that there is a drop off and that a physician or medical provider can be able to kind of deduce this. That's the line in blue. So when we look at the line in purple, that GM stands for gray matter. And so it's the aspect of the neurons and tracts that are present. And then that sort of grayish line is white matter. And then green is network physiologic. So we can see probably the greatest drop off in this network physiologic. So what the heck does that mean? What that means is how well the networks work well together. And can we be able to foster that, to bolster that? So it's not just the aspect of an anatomical loss that's causing cognitive decline, but us being able to improve the physiology by being able to trigger those things to make things better. We take a look. What are some of the things that can occur that can be impactful to cognitive decline, particularly over time? One of the things that we can see is things like smoking, hyperglycemia, and obesity. So if we can be able to improve those things, we may be able to stave things off. But what most of my viewers and patients would probably say is, yeah, I got those things under control, or I'm working on it. What can I do in addition to that? And that's when we talk about TDCS. So TDCS looks something like this, which I think for most people would say, oh man, this looks really complicated. It looks like it could potentially be uncomfortable and painful. It couldn't be the furthest thing from the truth. So in essence, it's like a stimulation that you probably can't even sense and feel. It's a small electrical current that's completely different from ECT, from TMS, and other things like that. But what it's able to do is to make those networks be able to improve. Most people would say, is there research behind it? Of course there is, or otherwise we wouldn't be talking about it on this channel. So what we can be able to see is that when you look at TDCS and a number of actual publications in PubMed, which is obviously one of the greatest elements of and databases to be able to assess research, we can see that the number has increased and skyrocketed for the last 20 years. What we can see that there's an increase in tinnitus, schizophrenia, chronic pain, movement disorders, depression, and then cognitive rehab. And these are some of the primary utilizations of TDCS. So people would say, okay, I get it, but how does that work and how is that going to make me better? So let's talk about that. We take a look. Basically, there's two electrodes that are placed, and those electrodes have the aspect of a small current that's in place. That current goes to the areas of the cortex initially, but then it has feedback to a number of other different areas, including the thalamus, the hippocampus, the amygdala, parts of the cervical spine, and other elements of the nerves that exist in that area, in that region, in order to be able to get a response. And as you recall from that graph, there was a number of different indications and potential options that you can be able to utilize TMS for. So accordingly, we know that not one size is going to fit all, and there's different prescriptions of where you could have that small electrical current that you won't be able to perceive that can be able to impact things. So we talk about it where you put those aspects of the cathode and anode, where those actual sensors are, matters in terms of how that conductivity is present. So let's talk a little bit more about how this might be impactful for the aspect of cognitive decline. When we think about TDCS, one of the things that we think makes a huge difference is by placing it in the temporal lobe. So what does that mean? In the areas in and around here. Why is that important? Because those areas are what's important for short-term and long-term memory storage. So if we can be able to foster those networks and we can be able to improve that, that can be able to help people keep sharp, not just for a year or two, but for decades. So one of the different elements that looked at this, or one of the research, was therapeutic non-invasive brain stimulation in Alzheimer's disease. And this is not just for Alzheimer's in terms of a treatment, it's useful in other contexts, but this gives the breadth to be able to look at it. And what they're able to see is that a number of neurologic diagnoses were able to be able to kind of evaluate it for this plasticity and recovery. And TDCS, one of the things that is really interesting is it doesn't have to be just done in clinic. It's affordable, it's portable, and it may even be able to utilize as a home-based therapy if your clinician is set up for it. So when we talk about cognitive decline, what are some of the other areas besides the temporal region? Well, some of the other areas are the following. So we can see these areas that are similar to what is used in depression, where you can look at the dorsolateral prefrontal cortex, both on the left and on the right side, and various other areas that have been worked out in the temporal region and throughout that allow us to be able to get better benefit. So how does this relate to overall improvement? Because is it just for cognitive decline? Of course not. So there's something that's called peak performance, which has been used not only in peak athletes in order to be able to get the best they possibly can, but also within the military. So one site, which is neurotherapy, applied neurofield neurotherapy out of California, Nick Douglas's group has really leaned into this pretty aggressively. And neurofeedback, which has been kind of that passive utilization of how to be able to get brain waves utilized, was one of the things that was fairly prominent. But now we see that actually stimulation therapy may even be better. And what they've showed on their side is peak performance in terms of being able to recognize, have improved focus, improve processing rates, less anxiety and worry, has been markedly improved by using things like TDCS. And so what's been some of the individuals who have been able to utilize that, they have found everyone from Olympic skiers that have been able to have value from things like this to other like snowboarders and military pilots and such. And so it's one of the things that they've been able to do and show markedly improvement. So what is the traditional methodology of being able to actually implement something like this? Well, depending on where you are, whether it's in clinic or possibly at home, you'll have the element of a computer set up with pads that are being placed. And those pads have a solution that allows for conductivity to be able to take place. So they look something like this. So it's just a slight wetting of a traditional saline that would be in place, or depending on your setup, you may have a different type of band that looks kind of like this that might be of value. Traditionally, there's a programmer that has different programs that are allowed to be able to be utilized depending on what's the actual target. And what happens is that you have this generation of current flow from the anode to the cathode, and that component is fairly prominent depending on where you're placing it for the temporal region, for memory or other areas that can allow for you to have better benefit. So how does this improve things? Well, it improves things in a couple different ways. We think that it's able to improve, as mentioned, in terms of that aspect of the connection of different parts of the brain, the synaptic currents. It's able to improve junction coupling. It can be able to improve dendrites and channel dynamics, improve action potential. And so all those things have potential value. In addition, one of the other things that we think also happens is that TDCS can be able to improve not only the currents, but also regional blood flow, inflammatory response, which is also indicated in potential contexts of having challenges and problems, and synaptic effects as a whole. So TDCS has been shown not only to be useful for peak performance, but also for cognitive decline in terms of being able to deal with certain things like being able to improve overall circulatory, body mass index, and glucose control. One of the other elements that may be useful is the utilization of a method like this. If you found this video helpful, please hit the thumbs up button and let me know. If you think that there are certain elements of how this might apply to you, enter it in the comment section. I'd really be interested in seeing how this might be useful for you or someone that you care about. For those of you who like videos like this, subscribe to the channel. Love to be able to give you more insight about how you can be able to figure out what your options are, how to be able to live a long life, punch pain in the face, whether it's physical or mental, and get back to leading the life you deserve. Thank you so much and have a great day.